Hi, this is Dr. Naser Elkhalili, rheumatologist practicing in the area of Houston for the last 12 years. Finished from University of Texas Medical Branch. And we take care of mainly autoimmune diseases in the field of rheumatology, where usually an autoimmune disease means immune system generating antibodies can mistakenly target normal organs. Today we're going to speak about rheumatoid arthritis, which is a systemic progressive autoimmune disease. And this definition is very important because we say systemic but can present as joint pain. But joint pain is not the whole picture of rheumatoid arthritis. It's an autoimmune systemic disease. Can start at any age, from 15 to 90-year-old. And we see it on a daily basis with young patients or older patients. And rheumatoid, as we said, systemic but progressive if untreated or undiagnosed. Autoimmune, that your body will generate antibodies. So patients usually have no fault, no mistake in starting the disease. Eating healthy, exercise, staying healthy, definitely a good thing, but does not prevent the onset of rheumatoid arthritis. Usually it's genetic, plus some environmental factors triggering the onset of the disease. So rheumatoid can present at any age. It's progressive, slowly, insidious onset, but can progress to fulminant joint damage if mistreated or untreated or underdiagnosed. Nowadays, there's a lot of options to treat rheumatoid arthritis, including starting from oral medications we had been using for the last 60 years. And the biggest option used to be before is steroids, which it can be a great starting option but dangerous long-term option. Oral medications, usually called disease modifiers or DMARDs, to slow down, halt, or prevent damage of joints and subsequently other systems or organs. Orally can be beneficial, can help. There's a lot of data in helping, preventing, maintaining good life quality, daily activities, stay in work, prevent damage, prevent disabilities, prevent surgeries. And also nowadays, and for the last quite few years, we've been trying biological options to treat rheumatoid arthritis that have been inadequately treated by oral options. Patient cannot tolerate oral options or cannot get enough response, so we go to the next option as a biologic option. Biologics usually based on protein. They have a great safety track records and have risks and benefits, and we can discuss these details during your visit. So if you have rheumatoid arthritis, especially if it's early, it's easier to manage, it's better to prevent chronicity, disability, or damage. And these medications can be monitored for safety, and they've been studied for millions of patients. So rheumatoid arthritis is an autoimmune systemic progressive disease affecting about 2% of the population. So in the United States, we talk about 6 million people have or suffer with rheumatoid arthritis, ranging from mild disease, they need a mild medicine, to severe aggressive disease. We see it also in our practice. So if you feel or you have symptoms of symmetrical joint pain, chronic, when you rest you feel worse, when you move you feel better, that's a sign of autoimmune inflammation, can allude to the onset of rheumatoid arthritis. So we ask you to seek medical advice. So if you have any symptoms indicative of rheumatoid arthritis, we ask you to make a visit where we'll receive you here. We usually sit down, talk about some history, do a physical exam, and most likely we need some blood work to establish a diagnosis, the positivity and activity of the disease. As we said, some patients have aggressive disease, more aggressive than others. Some have mild disease, they need a mild medicine. So during the visit, we'll establish a plan, answer your concerns, establish a diagnosis, usually not blood work. Few cases need an x-ray, but currently with the new technology, advanced blood work, we can do it without the need for x-rays unless we fail treatment. So blood work will give us an idea about the positivity in more than 80% of the cases, and inflammation status or activity in the majority of the cases. So if you have any questions about this autoimmune disease or different autoimmune diseases like vasculitis, systemic lupus, or different issues, please make a comment or post a comment on this video. On next telecast or next video, we can answer it to the best we can and make it a general answer, keeping privacy under control. So if you have any concerns or symptoms indicate rheumatoid arthritis, you're welcome to call us at 2817-248184 and make an appointment, or you can visit us at cls.health under Rheumatology division and make an appointment. It can be done over the phone or online. Take care. Have a great day.